Good evening. I'd like to call this regular meeting of the Daviess County Fiscal Court to order. Ms. Marksberry, would you lead us in the pledge? The opening prayer and a pledge, please.
Turn my mic on, that would help. Our gracious Heavenly Father, we thank you for the beauty of our county and the passion of its people. We ask for your wisdom and guidance on our fiscal court as we make decisions that affect our citizens, and we seek your word as our guide. Please continue to bless and protect Judge Caslin, Commissioner Condor, and myself as we embark on this journey for the betterment of our county. I pray for safety and good health for our community and always seek protection for those who serve and protect us. I ask these things in Jesus' name. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Start your engines.
Thank you, Commissioner Marksberry. Well, welcome everyone, and good to have another full house here. So, Ms. Warren.
Item 1, consideration for presentation, A, Owensboro Health Community Report.
We have there you are, Gavin and Ms. Mark Mars, thank you all for joining us. If you would, I'm going to give you the floor. Jordan, do they need to turn on their mic? Okay, it's on. Yep. It's on. All right.
Thank you all very much. I'm Gavin Roberts. I'm the chair of the Owensboro Health Board, and I want to thank you all for the opportunity to come share good words about Owensboro Health and all the good that we're doing for this, not only this community, but for the region. As chair of the board, it's been a great 6 years since I've been on the board. I've got a couple more. It's my second year as chair. But right now, there is not any more time that there are headwinds that we're facing as a healthcare system and healthcare this nationwide. And we have no better leadership team that I can think of, and I'm so proud to work with them. What Mr. Marsh has put together, everybody over here that we've brought with us, it's an exceptional team, and I'd put them up against any others. All those systems that there's a Becker's report that I get every day and read every day about systems across the nation, and the number of layoffs, the number of services that healthcare systems are shutting down because of the employee shortage, the nurse shortage. We've talked about that, and Mr. Marsh will talk about the Innovation Center, but we're fixing that ourselves. We're not waiting for somebody else to do it. We're doing that here in Owensboro, Daviess County. So part of our mission is Owensboro Health exists to heal the sick and to improve the communities we serve. There's 18 counties that we serve, so we've grown. So probably since the last time we have presented to this board. So our vision, it is our desire to become a regional center of excellence by actively listening and partnering to meet the individual healthcare needs of those that we serve. So again, I want to thank you all for having us here, and I'm going to turn it over to Mr. Mark Marsh, CEO of Owensboro Health.
We got a clicker, or is there, Judge, is there? Or can I just say next, or what's easiest?
I think Jordan's got it.
Okay.
Are you going to?
Yeah, that's perfect. Okay, thank you, Jordan. Yep. Judge, commissioners, folks of Daviess County, thank you for allowing us a few minutes of your time. I know you're busy, but again, as you heard Gavin say, it's our honor to serve, and certainly we take this oath very seriously in healthcare. We've learned a lot in these last 3 years, that's for sure, with this pandemic, with this COVID. But again, we take it, as Gavin said, the mission about improving the health and the lives of each and every person we get a chance to serve. That's something we think about every day when we walk through those doors. So as Gavin said, I'm blessed with having a really smart team around me, and we've built a great team. Many of those have been here for many years, but we've built some other complements along that. But I know it's a pleasure to work alongside them, and more importantly, our team members, our 5,000 team members every day, who really are there to try to improve those lives and take great care of all those folks who they get to serve every day. So let me just walk through, and I'm going to try to get through fairly quickly, be respectful of your time. Let me walk through a few slides. So obviously the first slide I'm going to reference there is really just shows you a little bit of the geographical footprint certainly of what we get to serve and the lives we serve. We use a lot of data. We're really data rich now. We've learned in the last 2 years to understand that clinical data, the quality data, and really the market share to understand what those needs are. We've done a lot of what we call our community needs health assessment. So we understand what those social determinants are, such as housing, food, shelter, mental well-being, all those things. But we really need to understand our footprint. So what you're going to see there is really those counties that represent what we call our primary service area, and really shows you the various footprints in those very heavy populated areas. And so that's what we think about every day. So just to give you a representation of, again, the service area there, again, roughly 600,000 lives. Next. This is really just our bricks and mortar per se, and then some of the key statistics. Obviously, 3 hospitals. We brought on a new hospital now just 2 years down in Litchfield in Grayson County, as well as Twin Lakes Regional Medical Center, Muhlenberg, and then obviously Owensboro Regional. And so this just shows you our commitment to making sure that we are a regional-based facility. We know Daviess County is our hub, is where a majority of our consumers reside. But we also know healthcare is local. It's very important to provide that healthcare and having access, which I'll talk about in these regional areas. What may seem as a very easy drive for me to drive down from here to Muhlenberg, but to have somebody who's trying to care for a loved one being a part of that care, an hour drive in those windy roads can be a little dangerous at times. And so we are thinking about that access and what we can do, not just in Daviess County, but how do we expand that throughout the parameters. So again, this just kind of shares where we're at, number of births. You think about we're still growing. So, 2,500 births here in the region. That's quite a number of births. So next slide. Some of the key statistics, again, I referenced the 5,500 team members. And so I still believe what I'm being told is we're the largest employer west of Louisville. We enjoy that because we know, as I was at the chamber board meeting this morning, just talking about the partnerships and the importance of that and what we do together collaboratively, what we can do as it relates to healthcare education. And so we want to be doing our part. That's something I've challenged our leadership throughout, is to be very engaged, to be out in these various boards and not-for-profits. And I'll reference that. But again, we have 5,000 team members who stand ready. We're right in the middle of what we call our town hall meetings. It's our chance. I'll be doing 25 town hall meetings. I started them 2 weeks ago, and my intent is to be able to talk to 90% of our team members. And so that's here in Daviess County. It's Muhlenberg. That's our health plexus. And so we want to hear firsthand. I think it's really important for team members to understand kind of what they're achieving, the great work, and really be able to compliment them on the great work they're doing. But we also want to make sure that they understand kind of the vision, where they're going, and feel like they're a part of that. And so, again, that's our intent. We'll finish those up at the 1st of March. The other one that I'll really talk about is the emergency department visits. We know that you think about that, still one of the busiest ERs in the state, but collectively with the 3 ERs that we have, we almost did 100,000 visits this past year. And so that's a great thing in one sense, but we also know we're trying to do things for access points so we can cut down on those unnecessary emergency rooms. We know you read it. We want the emergencies to be used for the right way. So we're looking for ways to increase access and other types of means, urgent care, primary care, and so on. So, but again, very busy ER. And then lastly, I'll just reference that 14-day access to primary care. That is something that we heard loud and clear, and we've heard from our studies, is people were not being able to get into their primary care physicians in a timely manner. So what do? You do 2 things. You delay care. You don't get care right, so you prolong something. Now something more catastrophic comes up, or we go to an emergency room that maybe for something that really needs to be managed from our primary care. So we've tracked that. And that is one of what we call our success share goals this year. It's a goal that we really explain to our team members, our ER, everybody else, why that's important, because we want people to make sure they have great access to preventative care. And so 63% may seem low. That's well above the benchmark. And so we're striding every day. And so we know the number of primary care visits we've seen between this year and last year, we've grown exponentially. And so we're excited about that. Next slide. This is just the economic impact. You can certainly see the number of full-time equivalents that we have within the health system itself. So that's the difference. If you're thinking through 5,500, those are contract, those are part-time, but true full-time equivalents, we have 4,300 team members throughout Owensboro Health. You'll see the total salaries and benefits grown in those 2 years from 2021 to 2022, grew from $403 million to $460 million. Obviously, we brought Twin Lakes on during that time, but we've had to do a lot in salaries to keep up with that. We'll talk about certainly travelers. And the things that we want to do is be competitive to make sure we can retain those great team members. We've had to do some significant salary increases in a lot of our clinical areas because of the shortfalls. And so that's something we've been committed to. I don't know the exact dollar amounts, but we've done roughly 12 different increases along the way. Some of those are what they call market adjustments. But between our regular merit increase and market adjustments, we've done more than 12 increases over the last 18 months. And so those are things that we pay very close attention to because we don't want to lose people out of the market. Next slide. So as I think about those team members and what they mean to us, because as I say, it's not the bricks and mortar, but the greatest asset we have today, as I share, is our team members. It's very challenging, as Gavin said. There's a lot of headwinds. We have it much better than many of the other big suburban markets, where we have 30 traveling nurses right now. If I take you up to Louisville, each of those respective facilities could have over 200 traveling nurses and probably have over 300 open positions. Again, it's changing so rapidly. And so again, we want to make sure we recruit, but we want to retain. So we want to make sure they feel valued, they're respected. But as you can see, 50% of our workforce within those 4,300 folks reside in Daviess County. So that shows you the importance and how big Daviess County in that service area. But again, 50% of the workforce reside in Daviess County. Next slide. As you think about the occupational taxes and the importance of that and what that means for us, right? And so part of that is the hub and spoke. And so obviously with that number of workforce where we're at, I believe we truly are one of the key economic drivers, and we're grateful for that for many reasons. But again, $4.9 million in occupational taxes last year. Along with that, you can see the provider taxes, $14.8 million, but more importantly, $49 million, almost $50 million in spending in Medicaid spending. And so on average, I think the role is, I believe, about 1 in every 4 Kentuckians right now are currently under Medicaid. There is speculation. There's some things that are out there being discussed that some of the waivers that were put in place because of COVID, that people now are more eligible for Medicaid, some of that may go away. So some of those things are being discussed at Frankfurt. Certainly, we want to make sure people have access to health care. If you don't have some kind of insurance, then certainly that's going to put a strain on the system. But more importantly, it may cause people to delay care. So we're really working with our constituents to make sure we can keep that in place, because we're going to make sure people have access to affordable health care. Lastly, we've done more than $232 million in spending from our local economy by our employees. One statistic I'll share with you, we brought in this past year 32 new providers. And so we look at those needs, and from primary care to various specialties, the needs are. We're not growing enough physicians in every given specialty. We're competing against the bigger markets. Many years back, I'll say more than a decade back, things were starting to cut, and so we were producing less of every given specialty. So we have to fight for these great specialties, great clinicians, great physicians. But for every physician we bring in, this is a study by Merritt Hawkins, brings in $3.2 million on average of economic impact or revenue to a community. Again, $3.2 million, of which produces roughly about 17 FTEs per physician. Some of those are direct, obviously many of those are indirect, but on average about 5 new FTEs per clinic and another 12 indirect. So again, huge economic engine as you think about bringing in 25, 30 new physicians per year. Next slide. This is something we feel, as I talk about one of our success here, one of our strategic imperatives is about partnering and being a great partner with our communities. You know that, Judge, that I've shared with you in my early days, and most recently some of our great leaders here. We want to understand what those community needs are. How can we partner with them? Not always monetarily, we want to do that part, but how do we really roll up our sleeves? How do we be a part of that, right? And particularly as we think about housing, food, shelter, bringing access to better health care. But one of the greatest things we get to do every year is we look at things that we can do through the hospital in our grants program, is giving back to that community. You can see over the last 2 years, almost $1.2 million that we've given back. Most recently, we had 25 recipients that came in, and we had the pleasure of those 25 recipients letting them know we granted $524,000 to those not-for-profits. And many of those not-for-profits, you know who they are in the community. They are doing great services. And without that, we wouldn't be addressing some of those needs with our children, with our geriatric population, and so on, mental health. And so we feel very fortunate about what we can do around that grant program. Along with that, plenty of other small grants that we do, a lot of things in the food. We do things through our Owensboro Health food grants. We gave more than 13,000 pounds last year of food out to folks. And then you'll see we've got many listening sessions that we're doing. So a lot of those listening sessions, we're going out there to understand. Myself, and I don't want to call anybody out by name, but we got Debbie and some of our others who are community ambassadors, but we are out there because we want to understand what those needs are and how we can further support those. So again, we feel it is a privilege, and being a partner with the community is really, really important to Owensboro Health. Next slide. These are our strategic pillars. I mean, everybody has to have a roadmap, a blueprint of where you're going. This is something that we spent nearly a year with the board in various board retreats, board meetings, coming up with what is the strategic direction with this headwind that Gavin alluded to, with the ever-changing environment in healthcare. What are those core pillars that's going to drive us for the next several years? Tactics will change within, but these are the 6 things that we came away with. And I won't go into each every one of those, but as you can imagine, quality, right? Quality is building trust with your community. Healthcare is so important, right, about trust and ensuring people they're going to get great, exceptional, high-quality care in a safe environment, in a very patient-friendly environment. That's our motive every day. Being a great place to work, we want to have great team members. If we don't have great team members, it's not the bricks and mortar, it's the people. And so we really take a lot of pride in being a great place to work. Earning physician loyalty. We do so much in collaboration with our physicians to make sure that we're doing things, what we call service line development, to make sure that we can provide that high quality care, engaging them, making sure they have input. So I think we've done a lot of that over the last year and a half. I've already referenced partnering with the communities, the importance of that and what that means for us. We want to drive growth and innovation. There's a lot of things that we're doing on cutting edge. Is we want people to be able to receive that great care, those new technologies right here close to home, so they don't have to go. They don't have to leave to another neighboring community. So there's a lot that we've done. I won't talk about all the robotic care and other things that we're doing, not to mention this innovation center, which I'll get to. But again, very important. And then lastly, the patient experience. Serving individuals with excellence, right? As we think about that, when we get feedback from patients kind of expect through the trust to have good outcomes, right? To have good quality, get the right antibiotics. But how we cure you with kindness, how we involve you in your care, are we compassionate? Do we listen? All those things we're doing, and we're making sure that's permeated throughout. It's a work in progress. We have 5,000 team members, but that's something we talk about every day. We talk about that with our physicians, with our leaders. We want to be the most charismatic hospital you've ever seen, and we think as we do that stuff, less people are going to be inclined to leave. And so we've seen through that, we have scores, there's benchmarks, there's data that we collect under that patient experience. And so we're seeing a continual trajectory up of the great efforts and the great progress we're making. And we're sharing that with our team members. So again, these are our guiding principles. These are our 6 pillars. But again, they drive us every day, kind of making the daily decisions that we do. So next slide. So here we go. So 2-year look forward. And I don't know about anybody else's business, but I know healthcare. Been doing this 30 years. The last 3 years now of COVID have been unlike any other 3 years I've been in my first 27 years. And I can tell you, trying to project what's going to happen in healthcare the next 2 years, it's anybody's guess. But we know one thing for certain, if we continue to focus on the quality, the patient experience, being great listeners, being great community partners on those imperatives, we're going to be equipped. We're going to be better prepared that we can ensure that, you know what, you're going to have trust with your community. At the end of the day, guys, this is your hospital. This is still a community hospital, and we want to listen. We want to truly be a partner with you, and we want to make it better. We truly, there's that motto, and you've seen us say, we want to keep you healthy, we want to make you proud. And that's something we think about every day. But we think through these key drivers. New specialists. We're recruiting new specialists every day. We had a meeting this afternoon. We got several from oncology, GI, urology, and so on. But we want to bring that high-quality physician here to Owensboro and throughout the region. We want to make sure we have great access, as I've talked about that. If we can have all these specialists, but it takes you 6 months to get in somebody, that's not going to be very good, right? So we talk about that. We're doing a lot of creative things on centralized scheduling, things to make it more accommodating, make it easier. So a lot of innovative things around the scheduling. Mobile clinics. What have we learned during COVID? We can do a lot of things through mobile clinics, through virtual care. And so through that, you're going to see some things with mobile clinics as well as at the Innovation Center. We're going to be building mobile vans, mobile virtually trailers, and I call them hospital on wheels, where we can actually take these clinics out throughout these 17 counties to make sure people are getting preventative care. We can work directly with the employers to show up with the employers, to have these at the employers, to do their flu shots, the screenings, to really be a partner with them. So we're getting really innovative. And so how do we take that out there? We may not have all the specialists we need, but in many ways, we need to take that care of them anyway. So you're going to see a lot. That work is being paralleled right now. Leads me right to this next is workforce. This innovation center, again, I know I'm going to wrap up here quickly, but I could talk for an hour because this really is something, it's a difference maker. When myself and others got a chance to go to Frankfurt and certainly worked with Representative Suzanne Miles and some of our other great constituents, it was an easy sell. Because many times we go to Frankfurt and we say, you know what, here's our problem. We don't have enough healthcare workers. We don't have X, Y, or Z. But we came and we said, you know what, we have a problem, but we have a solution. We have something how we're going to fix this. We're going to grow our own. And through this collaboration with the 10 universities, and we sat down with every one of them, from Dr. Mitchell, Father Larry, and so on, 10, we're going to create the curriculum where we can teach right into the high schools. A lot of these high schools can't teach anatomy and physiology, math and sciences. So we're exciting to the guidance counselors. We're great to the high school superintendents. And we can grow 1,000 more healthcare workers a year. There's eyes and ears watching us all throughout the state. We know there's a big dollar. We're going to transform the the business center into the innovation center. That's underway. Next fall, we'll be teaching some classes out there throughout all of Western Kentucky. But if you think about that, and we all have problems with creating workforce and keeping workforce, if we can grow 20% of our workforce every single year and have that in the pipeline, is that going to make a difference? We believe it is. So we are really excited about that. Obviously, Bart Darrell, who was the former Kentucky Western president, is leading that charge. He couldn't be here tonight because he's out talking to some of the high schools and some of the superintendents. So we're very energized about what the Innovation Center is going to mean to us. Lastly, just some of the regional strategies. The partnerships I've alluded to, we are doing things directly with the employers. We've done a lot of listening with the employers to bring access to health care, to make it better for them. We know their health care spending is rising. We want to help them to figure out how to use their dollars, their resources more effectively. Service line development. So each of these development, we are working with our physicians in tandem to make sure we can improve access, improve quality of care, evidence-based practices, all those things. And so again, we're seeing early signs of great efforts there. It's really exciting because physicians are data-driven. So we're bringing a lot of this clinical data and we're sitting down, and you know what, just like anybody else, we're solving solutions. We're finding better ways to make things better for our patients. So a lot happening around that. And then I'll just say expansion in the neighboring communities. This is really important for us, particularly with Daviess County. You know that. And so as we add things, and it's been brought to my attention, I've shared and I've spoken to many of us, we have ideas and concepts, and we are in the process to expand things throughout this region. You know that, and I know from the old hospital and through my listening sessions, our intent is to expand and have more offerings in the west side of Daviess County. So I'll make sure that's under works. Gavin and I can attest to that. We've had things in the works, so our hopes, as they say, coming soon near you, but we will be addressing that in the near future. So thank you for that help. And lastly, just assessing the capital needs. We have to be prudent like everybody else. The daily operating costs for the hospital, have any idea what that is? So obviously with COVID, supply chain, but it costs $2.3 million a day to operate Owensboro Health, the health system, $2.3 million a day. In addition to that, the capital needs. You guys know that. You look at a piece of equipment. So an MRI or a CT or some of these things, they're not cheap. Just keeping up with the maintenance of hospitals. And sometimes you think of the equipment, but just the roofs. We got 2 facilities that certainly we got to keep up with that may be aging a little bit more. But the point is we're going to make sure we're very prudent on those capital dollars. We spend a lot of time to make sure we prioritize how we're going to spend those dollars. And so again, we're excited about that. We're going to bring more technology here, but capital needs is a big piece for us. And in closing, I'll say our journey is we want to be a top 100 health system. We want, again, folks to believe and have the confidence and trust if the service that we're going to provide, and I'd much rather say we're going to be exceptional in the 80%. Let's don't be mediocre 90%, but let's find those 80% that we can have great outcomes, great safety practice in place, great patient experience, and be exceptional at it. We call it operational excellence. And if we can do that, over time, we're going to see more and more patients wanting to stay here, and we're on a journey to a top 100 health system. And so this is our commitment to you. We appreciate the partnership, your support. I've had the pleasure of meeting with you. I look forward to more of those discussions. Just like you, we want to make this community better. And that's our commitment. I can tell you on behalf of this great team, who are much smarter than I am, but every day we motivate each other. We walk through those doors with a great sense of pride and thinking, what can we do better to better serve this community? And so that's our commitment. That's our oath to you, to this community. And we appreciate the time to come and present tonight to you and the group. Thank you.
Well, I think, excuse me, I thank you for coming and sharing with us. And I thank you for choosing to make Owensboro, Daviess County your home and to lead our hospital. I think I agree with Gavin. I think they made a good choice when they picked you. I don't know who the other candidates were, but just having met you and had several meetings with you since your arrival, I believe they've made the right choice. Before I ramble on, I'm going to see if the commissioners have any questions for you or any comments. Commissioner Casson.
Just want to say thank you for what you're doing for the community and what you guys have presented here tonight.
Thank you so much.
Much appreciated.
Thank you.
Commissioner Marksberry.
Yes, I want to reiterate that, and you know my feelings about the west side. I'd love to see a clinic or something over there, and so happy to hear that you all are pursuing that.
Absolutely. Thank you. Thank you for your help.
Commissioner Condor.
Thank you, Judge. Here we go. Yeah, 2.3 million a day. What were you like pre-COVID? Per day?
Pre-COVID about $1.9 million.
And so you've raised almost $500,000 in just 3-4 years
Yeah.
in
And so-
cost per
yeah,
day.
So some of that, now obviously we brought on a new facility.
Right.
But as I shared with the group, this contract labor and the things that we've had to do in these 13 plus increases, but contract labor roughly is about $20 million a year. So you think about, now we're at the end of this year, it's going to be about $40 million that we're paying in premium labor. And that's minimal compared to others. I can show and tell you other health systems in the state who are paying $10 million a month in premium labor. It's not sustainable.
So with those numbers, and the ever-going question is, why does it matter the number of days of cash the hospital has on hand to pay bills? And how many is that?
Yeah, so great question, Commissioner. 150 days. So that number is the same number that we had pre-COVID. Obviously, you guys heard some of the CARES money. Won't go on all the points of that. CARES money gave health systems a lot of money. Post all that, we found out later, post all that, you had to use it very specifically. We actually had to pay back a lot of that. So that's Medicare money. And so again, but apples to apples, we're right 150 days. And so you think about 2.3 million per day. That tells you how many, we have bond covenants. So there's certain things that we're required that we have. And so we're well above the requirements of those bond
So
covenants.
the financial stability is good.
Very strong.
Very strong, which is fantastic. Last question for you. You've mentioned at least 3 times about retention. And we're going to be bringing in all the students that hopefully will be working for you. How do you keep them? And what factors come into play when you want to retain a medical professional? What is that? What outside of salary, I get that. Benefits, I get that. What else needs to be done to make sure we retain all these people you're about to train?
So we're talking about the clinical folks, not the physician.
Sure.
Okay, yeah, obviously.
Whichever.
What
It doesn't matter to me if it's
let me
doctors or
start
not.
with the
It doesn't matter
staff.
to me.
It's our team members. There's
Yes.
5,000 team.
Yes.
Is you know what? They got to feel like they have a voice. They're valued. They're appreciated. These things that we're doing town hall, they take time. We do things that call Gimba boards. We're out there. Every one of us leaders are out there rounding every day, being visible, being listening. What can we do? What are the pebbles in your shoes? How do we make your life easier? So those are the things that we're doing. We've got nursing councils. We involve those frontline team members. We have things called Gimba boards where we actually go out there and there's a display throughout the hospital. You're going to see those are things that where we talk with them about what do we have to do to put practices in place around quality, safety, and patient experience. But like anywhere else, if I don't feel like I'm engaged and I'm not connecting to part of that, you're not going to retain people. Yes, we have to be competitive. We look at market performance on salaries. But you know what? What we have found out, if you realize they're a human person, you work with them, they feel valued, they have a relationship with their leaders, all those things make a difference.
And that seems on the surface one of the best changes that I believe your employees hopefully feel the same way, and that the retention issue doesn't happen anymore, especially if that happens. Because it seems as if in the past it didn't occur. Now it is. That's, I applaud all of you. Staff, Gavin, well, no, I don't applaud Gavin. Thank you so much for what you've done because that will make a difference.
Thank you.
Thank you.
So I've got a couple of comments. First of all, to echo Commissioner Marksberry's comments on the west side. I'm from the west side. We just met with Farm Bureau the other day. I know Gavin has a strong relationship with the Farm Bureau, and they told me that they had passed the information on to you all. So I too share Commissioner Marksberry's interest if you all can address that concern of theirs. You mentioned listening sessions and also town halls. If I understood you right, the listening sessions are for the community and the town halls are with your employees, or did I get
That's
that
correct.
backwards?
That's correct.
Okay.
So those listening sessions, we've been going out quite a bit already. So myself, Debbie, other leaders there, to really understand these not-for-profit agencies, to understand what we can do, housing crisis, food shelters, mental health. One of our great colleagues right here that we talk with is we're blessed to have great mental health here in Dr. Figueroa. And so we think about the things, mental health is not going away, guys. Burnout, those things are real. They're real here. On average, you may come into the ER for a clinical situation, but it's stated that 1 out of every 8 patients that come into the ER may be treated for a clinical, but there's some form of mental health opportunity. It just shows you. And COVID, I think, certainly is exacerbated. It didn't cause it. I think it's poured the kerosene on it. But we know mental well-being is a tough thing that we're struggling with as a society. But yeah, those listening sessions are with those not-for-profits.
Okay. You and I had talked some time ago, and I think there was an article in the paper about it as well, where our ambulance is not like in network, and I know you have had discussions with them. Just curious if you have anything you can share with us, or if we're not really in a place where you can give us any real good news.
I just say the works are an effort, or efforts and works, and so we're making progress. Okay. So AMR, certainly I think now with the Ambulance Authority now coming back, we've got individuals. Russ is going to serve on that as well as AR, so I think we're going to make some headway. And so we've had some great lunches with AMR. I think they have a full commitment, but obviously as they deal with that, they can't deal with one local community. They're a big constituent, right? So
right,
I think we're making headway.
Okay.
My hopes are to come back and have a solution for us in the near future.
I hope so as well. The only other thing I want to say on a personal note, and I know I shared, but I want the community to know, I agree with your commentary on the quality of care that you get. My grandson was born there as a preemie little over a year ago, and he was there 10 weeks in your NICU. And my daughter and her husband couldn't have been more pleased with the care they got. So I just want the community to know that. I know I sent you an email, a private email, and I asked you to please pass it on to the staff, which you told me you had. Yeah. Excuse me. The other thing, myself, I happened to find myself in your care, or your hospital's care, this past May, and spent 5 nights there and the days as well. I was treated well and recovered obviously enough to wind up here. So I just want to say thank you, and thank you for your whole team for the care you provide our community. So yeah, that's all I have. So I thank you all. I thank all of you who are team members with Mark, and thank you for choosing Owensboro and Daviess County as your home, and because I know with your all's talents, you could go wherever you please, and I'm glad that each of you has chosen our community as your community, and so thank you.
Thank you for allowing us to be here tonight. Thank you.
And you all don't have to stay for the rest of the meeting.
Okay.
All right. Thank you.
You ready?
Ready.
B, Treasurer's Report for January 2023.
Mr. Johnson.
Yes, Judge, as of January 31st, 23, total cash balance is $71,889,936 for all funds. General fund balance is $34,474,994. This is likely our highest cash balance point of the fiscal year, as we've now received most all of our property tax revenue from the Sheriff's Office. Otherwise, all funds are operating within expected ranges, and I have nothing to report.
Do any of the commissioners have any questions for Mr. Johnson?
No.
And to the public, this report is on file. If you want to come in and look at it, we'll make it available to you.
Item 2, consideration for approval, A, minutes of the February 9, 2023 Daviess County Fiscal Court meeting.
I'll make a motion to approve.
Second?
Got a motion and a second. Do we have any changes or corrections for to the minutes? Hearing none, all those in favor signify by saying aye.
Aye.
Motion carries.
B, all claims for all departments.
Motion to approve?
Second.
Got a motion and second. We've got all the bills due and payable of the county. Do anybody have any questions for our treasurer?
No.
Hearing none, all those in favor signify by saying aye.
Aye.
C, audit engagement letter for fiscal year 2023 with MCM CPAs and Advisors LLP.
I'll make a motion to approve.
Second?
Got a motion and a second. Mr. Johnson.
Yes, Judge, the State Auditor's Office has declined to conduct the fiscal year 23 audit and has given us leave to contract with a CPA firm to do so. This is the engagement letter with MCM CPAs and Advisors to conduct our annual audit. We have used MCM in the past. We've been very pleased with their service and performance. The state has had no issues in review of the audits they've conducted for Daviess County. I would recommend your approval.
Thank you. Any questions of our treasurer? Hearing none, all those in favor signify by saying aye.
Aye.
Jenny?
D, county jailer's annual incentive payment for county calendar year 2023.
Make a motion to approve.
Second?
Got a motion and a second. Mr. Johnson.
Yes, Judge, for certain elected officials upon completion of 40 hours of training per KRS 64.5275, Section 6, Fiscal Court is required to pay a specified incentive payment directed by a letter from the Department for Local Government. You have before you the letter for jailer Arthur Maglinger. Although this payment is required by state law, it must still be reviewed and approved by Fiscal Court. I would recommend approval.
Any questions by the commissioners? Hearing none, all those in favor signify by saying aye.
Aye.
Jenny?
E, Resolution 4, 2023, designation of applicant's agent.
Motion to approve.
I'll second it.
Got a motion and a second. Mr. Johnson.
Each electorate term, FEMA and Kentucky EMA require that the fiscal court name an applicant agent that will sign and submit applications for any grant funding from federal disaster assistance through FEMA and the Disaster Relief Act. I have completed the required training. I've served as the applicant agent for the last 2 terms and can continue to do so on behalf of the fiscal court. It should be noted this is for applications of funding only. Nothing I would sign would encumber the court in any way. Any and all grant awards pursued by EMA would come to fiscal court for ultimate approval and review. I request your approval.
Any questions for the treasurer?
Nope.
Hearing none, all those in favor signify by saying aye.
Aye.
F, contract with Summerill Law Firm PLLC for federal per diem rate application and negotiation services for the Daviess County Detention Center.
Motion to approve.
Second.
Got a motion and a second. Mr. Johnson.
Yes, Judge, the current term of our contract with the United States Marshals ends December of '24, which is the point we would normally attempt to renegotiate our federal per diem rate. Recently, U.S. Marshals announced they would entertain renegotiations for reimbursement rates out of cycle in light of COVID-19's impact on correction facility expenses. Jailer Maglinger made contact with Summerill Law Firm, who specialize in negotiating per diem rates and guard pay for detention centers. This is the resulting contract where Summerill Law Firm will prepare our application, conduct negotiations with the U.S. Marshals on behalf of the Daviess County Detention Center. They have been successful in negotiating higher federal per diem rates for jails across the state, and after internal review and feedback from jailers across the Commonwealth who have utilized them, we believe these services will be of long-term benefit. The jailer, legal, and myself have reviewed the contract. It is in order. I would recommend approval.
Any questions for Mr. Johnson?
No.
Jordan, would you, since we have a crowd here with us, you mind saying how much, if this renegotiation is successful, what's the estimated savings to Daviess County taxpayers?
Yes, our current federal per diem rate is $55 per inmate per day. Summerill has said, based on their regional analysis, they believe they can negotiate $70 per inmate per day, which would result in annual revenue of $410,000.
Okay, thank you. So, hearing no further questions, all those in favor signify by saying aye.
Aye.
G, professional services contract amendment number 2 with Trot Communications for post-final system acceptance services.
Make a motion to approve.
I'll second.
Got a motion and second. Mr. Johnson.
Our current agreement with Trot Communications ends once we take final acceptance of the P25 digital radio system. Cutover has already been established, and we are now in the no-error trial period with the system, with final acceptance occurring after 30 days with 0 errors. This amendment would provide fixed pricing for their services following final acceptance with a not-to-exceed total of $25,000. We have been extremely impressed with Trot's knowledge base and service as a consultant firm throughout this project. We would like to retain those services for the remaining and potentially unknown items after system acceptance. Legal and myself have reviewed the amendment. It is in order, and I would recommend approval.
Any questions from the commissioners for Mr. Johnson?
No.
Any questions from the public? Hearing none, all those in favor signify by saying aye.
Aye.
Motion carries.
H, MOA with River Valley Behavioral Health and Davis County Mental Health Court, and rescind any and all prior mental health court agreements.
Motion to approve.
I'll second it.
Got a motion and second. And before I invite our guests to the podium, I wanted to just let the public know that over the past few weeks, I've had a number of conversations with our county attorney, Mr. Burlew, and also with Judge Lisa Jones, and about the future of our mental health court program. And quite frankly, I was concerned with where we would see it go. I was very pleased that when Judge Jones contacted me and said that she had reached out to Dr. Figueroa at River Valley, and we entered conversations that have gone very well. And I'm very pleased that we have this on the agenda tonight. And I welcome either one of you that wish to speak to come up to the podium.
Thank you. I just wanted to thank the commission, thank River Valley, thank the community and all of our community partners who are here to show their support for mental health court. As Mr. Marsh said when he was presenting the hospital's report, mental health is at the forefront of the medical field right now. There is the State Judicial Commission on Mental Health. It's at the forefront of the judiciary right now. And as River Valley will tell you, it's at the forefront of their concerns. I've talked to Jailer Magdalena, and he said that over half of the inmates at the detention center suffer from mental illness. So it's a concern across the board. It affects all of our lives. It affects our loved ones. It affects our community. It affects our safety. It affects our health. It affects the spending that we do for these things. And so we are happy to partner with the county, happy to partner with all of our community partners, happy to partner with River Valley in trying to expand early identification and early access to mental health services through the courts and through the community, utilizing the evidence-based sequential intercept model. And I will defer now to Dr. Figueroa to talk more about the partnership and more about that model. Thank you.
Thank you.
Good evening.
Good evening.
On behalf of our River Valley team, I want to thank you, each one of the commissioners and the department leaders, for the opportunity to collaborate with you and also to collaborate with other partners in the community to further expand the mental health court. We are very fortunate to have the mental health court as a resource in our community. There are less than 5 mental health courts in the Commonwealth, and quite common we receive calls from other counties that they want to know how we're doing the mental health court because the results are very positive, and they want to use the model that have been built in Daviess County to advance progress in their own communities. So a mental health court is a great asset in the community. It helps build safe communities and healthier communities. And Owensboro Health talk about their plans and how they want to expand medical services, healthcare services, prevention services. Know that we're also working with them in order to integrate physical health and mental health, behavioral health into their services. This is something that is often ignored in many communities, but I keep saying that Daviess is such a wonderful place to have the kind of innovative programming and services in any single community. So we are extremely fortunate to be part of this. 3 or 4 years ago, when we started the mental health court in Daviess, since then, since their implementation, we have been not only a financial supporter, but also a service supporter. So when you call and Judge Jones asked us to be part of this, we could not be more thrilled. 3 years ago, a River Valley team also started the implementation of the sequential intercept model. This is an evidence-based framework that we discussed in our team in River Valley. We talked to law enforcement. We talked to so many others. We submitted an application for a federal grant. We didn't get it. We were heartbroken, but we are relentless. That's something that you need to know about us. And we decided that we were going to build the capacity in each one of the intercept because we know it was the right thing for this community. And so when the Supreme Court, the Kentucky Supreme Court, implemented the Commission of Mental Health, we were very pleased to have one of our own represented and appointed to the commission, Judge Jones. And then by the second meeting that they have, they brought consultants to talk about the sequential intercept model. We almost have a party at River Valley because it's like we felt that we were ahead of time. We were at the pulse of the things that needs to happen. We were probably too early in the process, but we were on the right track. And we have been working and getting grants at no cost to the county. That's why we have the 24/7 mental health mobile crisis that has been tremendously impactful. And we have expanded our services with the courts, with the reentry population. We definitely want to do more in regards to prevention and build healthy, safe communities. And so across the counties that we serve, and certainly here in Daviess County. So I want our team to stand because they are the leaders of what's going on in regards to the intercept model. And every time I go to a meeting, I keep bringing this up. People probably are tired of seeing it, but we are relentless, as I say. So I want them to stand because we are committing to you. We are making a commitment to you that we are honored by your confidence and trust, and we will do what it takes and then more to make sure that this is successful and that we continue to be a model across the Commonwealth. If there is a county that can lead this effort in our Commonwealth, it's Daviess County. The momentum is in our favor, and to do the right thing for people with severe mental illness and get them access to the resources that they need. And I think that with the dedication of leaders like you, we will make it happen. So thank you so much. Thank you.
Do any of the commissioners have any questions?
I don't have any questions, but I would like to make a comment and say Judge Jones, Dr. Phelps, Dr. Figueroa, and all the staff here from River Valley, you have changed the face of what it's like for our community to help assist those who are suffering from a crisis or just dealing with mental health. And thank you so much for what you've done. In the years that I've been as a law enforcement officer and in the years after, I see the changes that have been made in our community, and it's because of what River Valley does, and thank you so much for what you do.
Amen. Commissioner Marksberry.
I'd just like to say thank you as well, and I'm glad we got this resolved and that everyone is pleased with it.
Commissioner Conder.
Let's get the good work done and keep going. Thank you for everybody.
I just want to say thank you as well, and I'm just as I told Mark Marsh, I'm glad he's here. I'm glad that you choose to make this your home and to lead River Valley, and and Judge Jones, again, thank you for thinking of River Valley and inviting them to be a part of this process. So, because I hear your enthusiasm, and I appreciate it. And to echo what Commissioner Caslen said, I agree that the programs that you all have created and implemented, I think, outside of mental health court, I think are very good for our community. I appreciate that you've had the foresight to do it, and commend you for that. Is there anybody else that would like to speak to this issue before we vote on it? Hearing no takers, all those in favor signify by saying aye.
Aye.
I, office space lease agreement.
Just a second. Y'all don't have to stay if you don't wish. Thank you.
Cleared half the room.
That's all right. Thank you. Go ahead.
Motion to approve.
We haven't read it yet.
I, office lease agreement with Davis County Attorney's Child Support Division. Larry,
Motion
I'll
to
take
approve.
that motion.
I'll second it.
You got a motion and a second. Mr. Johnson.
Yes, Judge, Fiscal Court has reimbursed the cost of the Child Support Division of the County Attorney's Office through a state contract consisting of Title IV funds and other agency funding at the state and federal level. An applicable expense for reimbursement is the leased space to accommodate child support services in the Robert M. Kirtley Judicial Annex. The state has agreed to reimburse up to $14 per square foot per annum, which results in annual rental revenue of $40,152. Legal and myself have reviewed the agreement. It is in order, and I would recommend approval.
Okay. Any questions from the commissioners?
No.
Hearing none, all those in favor signify by saying aye.
Aye.
J, declare the following as surplus inventory and transfer as follows. Police Interceptor Unit to Davis County Public Schools.
I'll make the motion to approve.
Second.
Got a motion and a second. Mr. Johnson.
Unit number 415 in the Sheriff's Office had transmission issues and was removed from the fleet pending estimated repair costs some time ago. In light of the estimates he received, Sheriff Youngman elected not to repair the unit and instead set it aside for our next auction, which is likely mid to late '24. Davis County Public Schools has since shown interest in the unit, approached Sheriff Youngman, and have requested that we transfer it to them so they can repair it and put it in light use. This requires the court to declare the item surplus and transfer it to Davis County Public Schools in accordance with KRS 67.0802, Section 4. Sheriff Youngman is in agreement. I see no issues, and I would recommend approval.
Sheriff Youngman, I see you're here. If you would like to speak to it, you're welcome to. And if Jordan's comments are enough, that's good enough with me. Commissioners, any question for Mr. Johnson?
No questions.
Hearing none, all those in favor signify by saying aye.
Aye.
K, award bid numbers 2223-41, 2223-45, and 2223-48.
Motion to approve.
I'll second it.
Got a motion and a second. Mr. Johnson.
Beginning with 222341 for electronic poll book system for the clerk's office. Historically, the State Board of Elections has purchased e-poll books and distributed them to all clerk's offices in the Commonwealth for elections. Late 2022, the state made the decision that all fiscal courts are now responsible for purchasing an electronic poll book system for their respective clerk's office. This bid, as the result of that decision, is to purchase the necessary items while also contracting ongoing maintenance and support with the successful bidder to control ongoing costs. We received 2 bids and recommend the lowest and best evaluated bid submitted by 10X Software Solutions in the amount of $120,420 for the equipment and the respective schedules of support services and maintenance, which have a contract period extending from the date of award to December 31st, 2028. I would recommend approval.
Any questions, Mr. Johnson?
No.
And I'm kind of hard of hearing, and but I'm just curious. I know we had talked previously that the state's plan was to reimburse counties for for these purchases up to a certain dollar threshold. Is this bid per unit under the threshold to where we will get full reimbursement?
Yes, sir.
Or will this be a partial?
The State Board of Elections will reimburse up to $1,700 per unit. Our bid came in at roughly $1,300 per unit.
Okay, very good. Any questions from the public on this issue? Seeing none, all those in favor signify by saying aye.
Aye.
Whoops. We're not supposed to vote yet, so let's withdraw that. Yes, sorry about that.
Moving to 222345, Fiscal Court received 2 bids for the provision of 1 new 6x6 utility vehicle for the Daviess County Fire Department to be used for fighting brush fires, and we recommend award to the lowest and best evaluated bid submitted by Cave Run Motorsports for the 2023 Can-Am Defender 6x6 DPS HD10 unit in the amount of $22,567.18. This is a budgeted replacement. There were no exceptions to our specifications, and I would recommend approval.
Any questions of the commissioners?
No.
Any questions from the public? Next item, Jordan.
Final item, 222348, Fiscal Court received 1 bid for the provision of 1 new single-axle dump truck for the Daviess County Road Department, and we recommend award to the only bid submitted by Sternberg Chrysler for the 2023 Ram 5500 unit in the amount of $79,900. This is a budgeted item. It did come in under budget. There were no exceptions, and I would recommend approval.
Any questions, Mr. Johnson?
No.
Any questions from the public? Now, all those in favor signify by saying aye.
Aye.
L, reject bid numbers 2223-43 and 2223-47.
I'll make a motion to approve.
I'll second.
Got a motion and a second. Mr. Johnson.
Beginning with 222343, this bid was for the provision of 2 new community notification sirens for the Emergency Management Agency. The items, prices, and/or exceptions of the bid results were outside the range that management deems acceptable, and we recommend rejecting all bids and rebidding this item at a later date. EMA Director Andy Ball has stated that this does not jeopardize his project timeline. I would recommend rejection.
Any questions on that item for Mr. Jordan?
No.
Next item, sir.
222347, this bid was for the provision of 1 newer used chassis cab unit for the Grimes Avenue Transfer Station. Again, the items, prices, and/or exceptions of the bid results were outside the range that we deem acceptable. And we recommend rejecting all bids and rebidding this item at a later date with altered requirements and/or specifications. Transfer Station Management have stated they can continue utilizing Fleet Maintenance's unit for the interim. I would recommend rejection.
Okay. Any questions for Mr. Johnson?
No.
Hearing none, all those in favor signify by saying aye.
Aye.
M, surety bond and damage deposit release for all road excess weight permit.
I'll make the motion to approve.
Second?
Got a motion and a second. Mr. Brasher.
Yes, Judge, this is an existing excess weight permit. The holder of that permit has stated that they are no longer utilizing this road for excess weight hauling. We have reviewed the road, and we recommend approval.
So just to be clear, when you say you've reviewed the road, so there's no damage that they've caused with their...
Normal wear and tear at this point.
Okay. Any other questions for Mr. Brasher?
No.
Hearing none, all those in favor signify by saying aye.
Aye.
N, surety bond and damage deposit release for Free Silver Road excess weight permit.
I'll make a motion to approve.
Second?
We got a motion and a second. Mr. Brasher.
Similar to the last excess weight permit, other than this one was just a crossing. We have reviewed that crossing, and the road is in great repair. I recommend approval.
Any questions for Mr. Brasher?
No.
Hearing none, all those in favor signify by saying aye. Aye.
O, personnel reclassification, Kelly Wathen to Public Works Office Manager.
I'll make a motion to approve.
I'll second.
Got a motion and a second. Mr. Johnson.
Yes, Judge. Items O and P on the agenda are the result of a reorganization of duties to streamline various processes and administration at the courthouse and all departments housed at the Operations Center. These employees will be reclassified under different titles to reflect the assignment of reorganized duties. I request your approval.
Any questions for Mr. Johnson?
No.
All those in favor signify by saying aye. Aye.
P, personnel reclassification, Candace Sturgeon to staff accountant.
I'll make a motion to approve.
Second?
We got a motion and a second, and Mr. Johnson just addressed this when he addressed item O, so I'm not going to ask him to address it again. All those in favor signify by saying aye.
Aye.
Q, promote Kevin Payne to road department service technician effective March 6, 2023.
Motion to approve.
Second.
Got a motion and a second. Mr. Brasher.
Yes, Judge, this is an open existing position. Mr. Payne is an existing employee. He's being promoted over to Road Department. I recommend approval.
Any questions for Mr. Brasher?
No.
Hearing none, all those in favor signify by saying aye.
Aye.
And I do want to say congratulations. Anytime we can promote somebody from within, I think it's a good thing. It shows we have good staff on board.
R, hire Joseph Fulkerson as road department service technician effective February 27, 2023.
I'll make a motion to approve.
Second.
Got a motion and a second. Mr. Brasher.
This is an existing position left open. I would recommend approval.
Any questions for Mr. Brasher? Hearing none, all those in favor signify by saying aye. Aye.
S, appoint Sonny Renfro, McLean County Representative, and Brandon Ferguson, Muhlenberg County Representative, to the Green River Regional Industrial Development Authority Board effective 12/31/2022.
Motion to approve.
Second.
Got a motion and a second. For any of those who do not know, Green River Regional Industrial Development Authority Board manages what is known as Bluegrass Crossings Business Center in Ohio County. And this item approves and confirms the respective fiscal court appointments. So it's a multi-county board, and because of that, we're required to approve appointments of these individuals. Any other comments or questions? Hearing none, all those in favor signify by saying aye.
Aye.
T, appoint Tom Lilly to the Owensboro Regional Hospital Board effective February 23, 2023, expiring 10/31/2023.
And before this vote, I'll say as an employee of Owensboro Health, I'll be abstaining from this vote.
Okay, thank you.
Motion to approve.
Second.
Got a motion and a second. I've known Mr. Lilly for a long time. He has quite a bit of hospital experience on his resume, and I think he'll make an excellent board member, and I appreciate his willingness to serve our community in this manner. All those in favor signify by saying aye.
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 Aye. And let the record reflect that Commissioner Casson abstained.
U, appoint Teresa Borman to the OMPC Board effective immediately, expiring 12/31/2024.
Make a motion to approve.
Second?
Got a motion and a second. I've known Ms. Borman for many years, and she has, her husband's involved in farming. She's got a couple businesses, and I think she will make an excellent board member, and I appreciate her willingness to serve our community in this manner. All those in favor signify by saying aye.
Aye.
V, appoint Doug Hoyt to the Owensboro-Davis County Regional Airport Board effective 3/1/2023.
I'll make a motion to approve.
Second?
Got a motion and a second. I want to thank Mr. Hoyt for his willingness to serve. He currently serves as the chairperson of the airport board. I think especially with this appointment and also the next one, the things that are going on at the airport, we've got a master, I think it's called a long-term master plan that they're working on, and also the new contract, ESA contract, I think it's called, that we're working on. I think it's important to have stability in the board appointments, and I appreciate his willingness to serve. All those in favor signify by saying aye.
Aye.
W, appoint Mickey Bowman to the Owensboro-Davis County Regional Airport Board effective 3/1/2023.
Make a motion to approve.
Second?
Got a motion and a second, and the comments I just made on Mr. Hoyt would apply to Mr. Bowman as well, so I'll let it go with that. And thank him for his willingness to serve our community. And all those in favor signify by saying aye.
Aye.
Motion carries.
X, second reading of KOC 21.22, 2023, and ordinance relating to the Davis County Road, Bridge, and Street System.
Motion to approve.
I'll second it.
Got a motion and a second. This Mr. Brasher.
Yes, Judge. As discussed last fiscal court meeting with the first reading, this is an annual process where we make changes to our road index based on the previous year's acceptance of roads or name changes in the case of this year. So in essence, we've approved, reviewed 1.31 additional miles of roads previous year, and I would recommend approval.
And you do not have any that are being taken off of the index?
Correct.
Okay. Any questions from the commissioners?
No.
Any questions from the public? Hearing none, all those in favor signify by saying aye.
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 3, consideration for discussion, A, other business to be brought before the Davis County Fiscal Court. I'm not aware of any.
Not aware of any. All right. Next item,
B, public comments.
public comments. This is where we allow the public to come to the podiums. Identify yourself, give your name and address for the record, and then you're willing to speak on any item that was not on the agenda. Yes, sir.
Good evening, Judge Caslin,
Good evening.
Commissioners, ladies, gentlemen. With your permission, my lovely assistant has some reading material to hand out to you.
Okay.
Thank you. We're here tonight while you consider your budget for the upcoming fiscal year to ask you to withhold our tax dollars.
Jerry, I know who you are, but for the record, would you say who you are?
I'm sorry. Jerry Chapman, 2601 Elwood Court. We're here to ask you to withhold our tax dollars from the River Park Center until they stop hosting drag shows. I believe each of you are good Christians, so I'll forego a sermon on the sinfulness of drag shows. I will note that the largest satanic meeting in the world will be hosting drag shows in Boston or in Baltimore in the coming weeks, though. Instead, I thought the findings of Dr. Sarah Hankins might be particularly persuasive in this situation. Instead of reading her long and considerable resume, I've included some of it anyway, in my printed comments that you've got in front of you. Suffice to say, Dr. Hankins is a highly respected, widely recognized, and outspoken leader of the LGBTQ community. Because I know you'll take the job we elected you to do as seriously as we do, I've made the copies for you to read at your leisure. Please note that Dr. Hankins uses the term gender performance and drag performance synonymously. Following are some conclusions from Dr. Hankins' article published in 2015 entitled, "I'm a cross between a clown, a stripper, and a streetwalker." Drag performances, she says, can be divided into 3 categories: straight ahead, gender F word, and burlesque. Straight ahead is probably drag's most recognizable form. Men impersonate women, women impersonate men. This is a form typically presented at Ghost Light. Dr. Hankins finds, and I quote, "Straight ahead performances draw audience members into all manner of illicit sexual relations. It allows the audience member to temporarily embody one or more of a number of bad or unnatural social positions, for instance, the pedophile or the sexualized child." Gender F word also finds its way into the Ghostlight Lounge often. Performers dressed as grotesque caricatures of humans or animals or demonic creatures collect trips from their audiences via an array of intentionally uncomfortable exchanges in order that the audience participants may internalize at a sensory or physical level experiences of dehumanization. Burlesque, the least common form of drag, is modeled on late 19th century vaudeville or cabaret striptease. Its sexual suggestiveness lends the performance immense symbolic power, but suffers from a lack of monetary exchange, so you will not see that quite as often. Dr. Hankins further observes, tipping, dollar bills changing hands tucked into cleavage, panties, waistbands, because it's an act closely associated with sex work and universally understood to be a marker of sex work, warranted close examination of the practice in drag performances. Because tipping is also understood by many scholars to be present within the dynamic of prostitution's illicit microeconomy, Hankins concludes that drag performance represents a distinct form of sex work. As an audience member, she even admits that she always viewed the tip exchange as payment for sexual gratification. Gender performances tip exchange then pays for deeply sensual and frequently erotic interactions between performers and audience members. That's quote. And it unfolds within gender performance's highly charged atmosphere of arousal and desire. Hankins, in that 27-page article in front of you, concludes, gender performance, drag shows, are sex work. So in the very words of a leader in the LGBT community, drag shows are sex work akin to prostitution. Last I checked, sex work was a highly regulated, more often than not, illegal industry. Now, Owensboro does not exist in a vacuum. Hundreds of communities just like Owensboro across the nation are besieged by these attempts to normalize this kind of behavior. All are at varying stages, and because they are, we can see a roadmap. We can see where they want to take Owensboro. We, the adults in this room, are not their targets. Our children are. Your children, your grandchildren are their targets, and they don't discriminate. Because the progressives pushing this gender ideology understand selling highly sexualized behavior to adults as good, clean fun, our children will be much easier to get to. So we ask respectfully, see these shows as they actually are, not as you've been told they are. We hope you'll recognize, like millions of Americans across this nation, the agenda driving these shows and acknowledge their ultimate purpose. On behalf of the citizens you were elected to represent, especially our children and grandchildren, please refuse to commit our tax dollars to any organization hosting these shows. Thank you.
Thank you, Jared. I know most of the people, I assume, are here on that topic and have come as an organized group. So I'm not going to ask for anyone else to speak to that. If there's anyone here that wishes to speak in a different tone or on a different topic, you're welcome to come to the podium. Seeing no takers. Yes. Yes, sir.
When you say a different topic, are you talking about the riverfront, the river park?
I'm saying if you're talking about the very issue that he was, the drag shows, I really don't. He was speaking for the entire group.
We're going to talk about the riverfront.
That's fine.
Yeah. My name is Mike Hamlet.
If you would say it again.
My name is Mike Hamlet.
Okay.
I live at 6160 Sutter Loop West, and I've been a resident of Owensboro and Daviess County since I was 2. So I can remember the riverfront down there when it was called the Riverfront Park. It was before Smothers Park. This was in the early 60s. And it was like, we went down there on the weekends and had a blast and played, and it was the storefront for our city. It was a beautiful place. a shining example. What they've done down there now, cities would drool to get. The riverfront we have, it's a beautiful thing. We're proud of it. Okay, we have to be careful about what we put in that window. That's all I'm going to say.
Anyone else? Seeing none, we'll go to item 3C. Comments for Daviess County Fiscal Court. Commissioner Casson, I think you had said you would like to go first, so I'll.
Yes. So I just, as a reminder to anybody that's watching tonight, that we do have a free paper shredding collection event on March 31st. It's going to be at the Sports Center, in the Sports Center parking lot. So bring any of your old files, receipts, cancel checks, those kind of things, tax forms. And it'll be run from 10 in the morning till 1 in the afternoon. It's open to all Daviess County residents. So businesses and institutions, there's a 100-pound limit per person. And Piranha Mobile Shredding will collect the documents for destructions. And if you have any questions, you can contact Daviess County Solid Waste Department, 270-229-4484.
And if you don't mind saying that date one more time.
That is March 31st of this year at the Sports Center from 10 in the morning to 1 in the afternoon.
All right, thank you. Anything else?
Thank you. That's it.
Commissioner Marksberry.
I really appreciate you all coming and speaking with us this evening, speaking from your heart. We hear you. We're doing our research, or I am. I'm speaking for myself. I'll make the best decisions I can for our community based upon the factual data obtained. And I want what is best for Daviess County, and that is always going to be my goal. On another note, as liaison commissioner for the animal shelter, I was blessed to meet Gunner. He's a little beagle mix that was the number 5,000th spay and neuter winner. So he got number 5,000, and he's walking around the next day, so he did good. So it's great to see how this is helping to decrease the population and keeping animals out of the shelter. And I would just like to say, if any of you all have a heart for animals, they could really use your help out there. They have some wonderful volunteers, but they always could use more help. So thank you.
Thank you, Commissioner, and I will echo your comments, but I will just say, as far as you said, Gunner did well. He did well, but Dr. Julie Gray did well as.
That's right.
Also, that's why he
Absolutely.
recovered so well.
Yes, that's right.
Commissioner Condor.
Thank you, Judge. Bear with me a little bit if the audience could do so. I would like to take this time to address a topic that has been discussed, social media and everything else around there. And that has to do with economic development in our community. I wrote a letter back in August of 2021 that addressed that issue almost head on at that time. And part of that had to do with the business that was located in Henderson, Kentucky, Pratt Industries. And the reason I know about that is because I was intimately involved in that almost 2 years ago, of that business coming to the city of Henderson and the amount of natural gas that they were going to actually be needing. The story is kind of odd how it happens, but hang with me. When we first met, there was a gentleman, nice guy, dressed pretty good, but he was going back and forth asking me several questions about fuel for their plant. After it was over, one of the mayor came over to me and said, "Do you know who you were talking to?" I said, "I have no clue. I have no idea." It was the owner of Pratt Industries, the second wealthiest man in Australia, is who he was. Simple guy. Today, they're about to start production. It will be about 2 months from now, full bore. So in reality, it has taken 2 years to bring businesses to our area, and Pratt Industries is a prime example. And how that happened was very interesting. The owner of Pratt Industries, talked about, he was at a charity event with Muhammad Ali's widow. They started talking. So Muhammad Ali's widow said, "I need to introduce you to the governor." She brought the governor over to him. They started talking. That's how it began. Those relationships of what comes to the state of Kentucky is paramount. Yes, we have to check the boxes of land, roads, streets, and everything else. We have to do all that. At the end of the day, what I believe we all should support, is that economic development is growing the tax base. What that means is those companies that come in, those jobs that come in, produce a revenue stream where others might not be able to afford. Because if they don't come in, guess what? One of two things is going to happen. You're going to either cut services or funding, or you're going to raise taxes, or a combination thereof. That's not a good solution at all. So my point being, after talking about this, I got a little tired of hearing the governor several times, and most recently say, in economic development in our state, over $5 billion has been awarded to the state of Kentucky, but not one time has the governor ever mentioned Daviess County. Why is that? Those are the conversations we need to have, and they're hard conversations. The hard assets, one issue, but really figuring out how we can present ourselves to businesses, to Frankfurt, to Washington, D.C., that, hey, we matter. And we're going to try to make sure that that economic development question, it becomes a narrative. So here's what I'd like to suggest. I know that it is very rarely done where the city and county have closed session, and there's a lot of legalities to that. You can only have closed session for 3 reasons: personnel issue, legal issues, or acquisition of property. That's all you can do. You can't do anything else. Everything else has to be in the public. Those are the rules. So that's maybe a little problematic, but hopefully, if there is a project that comes about, that we, Fiscal Corp, City of Owensboro, goes in that closed session, let's see if we can really get something like that done, if it occurs. The other thing that maybe is an option is, do we really want to have maybe a public forum where individuals come, all the stakeholders come, all the citizens maybe come to really talk about this issue? And I totally understand that we need to get our feet underneath us, as Fiscal Court does, of what that means of land, infrastructure, money, that whole bit, before that occurs. But in time, my hope is that one of those 2 things are remembered, and we continue to do that in the future. So I thank you for the time, Judge. I hope that maybe we can move forward, and everybody understands Fiscal Court will always look at new businesses that come to us in a good way to make sure that our citizens, all of our citizens, have an opportunity to succeed. Thank you, sir.
Thank you, sir. So, my closing comments. We are very blessed to have folks who are dedicated to serving our community as volunteer firemen. And we had one pass away. I saw his obituary right after our last meeting. But Levi Baker Jr., I just want to read his name and say that his obituary says he was a volunteer fireman with the Houston Volunteer Fire Department for 44 years. And that's the kind of dedication and service that we get from our citizens who serve as volunteer firemen. And we were just out at Stanley. They had their annual meeting a couple days ago, and I'm from Stanley, so I made a point of going to that meeting. And they're getting ready to celebrate their 50-year anniversary of being in existence. And most of the board chairs are gentlemen who were either my ball coaches or other young adults back when I was a kid. And they're still serving our community in their roles as board members. And then we were fortunate to meet. I believe they announced they have 5 new recruits that are coming on board out there. And it's important that we have the youngsters come as well, come on board as the old timers like myself fade away. Anyway, I also want to announce that February 24th and 25th at the River Park Center, we are having a yeah, but I'm not, it doesn't even say River Park Center, but that is where it is. Moneta Sleet Festival is titled Through Sleet's Eyes, and it will highlight his photography, that he did. He was a, help me out.
Pulitzer Prize.
Thank you, Pulitzer Prize winner. And he's from Owensboro. And so this festival was put on, actually Daviess County Fiscal Court, the last fiscal court, donated significant dollars to this effort to be able to put this on. It's no charge to attend. It's on the February 24th and 25th. I will say on Saturday, and I don't have the time on here, but I think at 7 p.m., the Owensboro Men's Mass Community Choir, of which I happen to be a proud member, will be singing some songs. So I would encourage you to come by and enjoy yourself and learn about Mr. Sleet's life.
And Judge Canceller, you are the anchor singer. I mean, you are the
say
star,
that.
correct?
I will not say that. We are a choir, and as a choir, we perform as a unit, not as individuals. But thank you for attempting to give me more of a headline than I deserve. Also, I want to just read this. Daviess County High School, OHS, Apollo High School, Burns Middle School finished cheer seasons with a bang at the Nationals, it says. And it says Daviess County, Apollo, and Owensboro High Schools, along with Burns Middle School cheerleading teams, went to cheer Nationals in Orlando, Florida at the 1st of February. Apollo and Owensboro season ended in the semifinals. Burns Middle School earned 5th in the nation for junior highs. Congratulations to them. And Daviess County High School grabbed 4th in the Super Varsity Game Day D1 non-tunneling division. So congratulations to them as well. Lent's here, and we've got a whole slew of fish fries. I'm not going to read them all off, but there's a whole slew of them, and I'm sure if you Google fish fries in Daviess County, you'll find them. And it's good eating if you want to go on Fridays. They're generally on Fridays. So with no further business, this meeting is adjourned. Thank y'all for coming.
Thank you.